I'm Jackie Powell. I'm President and CEO of the Dayton Convention Visitors Bureau, and we're very pleased that you're able to join us for our webinar today on Dayton Montgomery County Public Health. If I could ask everybody to please mute, that would be helpful, keeping some feedback and so on and so forth. So would appreciate it if you would do that. This webinar is being recorded and will be available. So just to let you know that from the start here. We are going to be speaking with some folks who have been doing a fabulous job for all of us. Our representatives today from Public Health for Dayton and Montgomery County are Jennifer Wenzel, who is the Director of Environmental Health, and the Public Information Supervisor, Dan Cefaletto. So we want to thank them for being available to do this today. First and foremost, I hope that all of you and your families have been staying well and safe, and that you continue to do so. And I want to thank each of you for attending our Zoom chat today. This is the second in a series of educational webinars that the Dayton Convention and Visitors Bureau is bringing to you. The first was on Ohio's tourism road to recovery, and it featured Melinda Huntley, who is the executive director for the Ohio Travel Association. A recording of that May webinar can be found on our website, which is daytoncvb.com, and it's on our YouTube channel. So you may want to take a look at that if you weren't able to participate. As our state and local community begin to reopen, it's important that we have the latest information and resources regarding health and safety protocols. Research data from industry experts such as Longwoods International and destination analysts is telling us that it is imperative to travel and tourism's recovery that travelers feel they will be safe in every aspect of their journey, and that this is the #1 factor driving the return of tourism. Travelers are looking for authoritative sources of information to determine when it is safe to travel. Organizations such as Montgomery County Public Health can help us with the information and help us define what we as local tourism entities need to do to meet safety mandates and communicate them to the public. The perception of safety and a sense of confidence in safety protocols needs to be addressed in order for any type of robust recovery to take place. So with that, first of all, just to let you know, if you have questions, and we hope that you do, please use the chat box at the bottom of your screen, and we will address those questions at the end of the presentation. I want to once again thank our speakers today, and with that, turn things over to Jennifer Wenzel and Dan Cefaletto.
Thank you for the invitation today. So we'll talk generally regarding the order that currently stands. We have several orders that are in place, and they are all, for the most part, sector specific or specific to certain areas of business. The Responsible Restart Ohio page, I'm going to share that, lists the orders as well as different information that you can use for your business. As we stand right now, there are no guidance being offered for large venues, hotels, motels, theaters, and public entertainment locations, as those are still ordered closed by the order. However, there are various other sector-specific guidance that's listed, and they're ranked out by category. Primary sectors, entertainment, outdoor activities, personal services, sports and sports leagues, and then as well as healthcare and hospitals. So as the Ohio Department of Health rolls out the specific guidance, those are placed on this website, and that is what we use to inform the community and the business community of what's permitted, what's allowed, and what's recommended to safely operate. So generally speaking, you can look at it that we still have to maintain 6 foot of distance. We still have to do a good job of washing our hands with soap and water. If that's not available, hand sanitizer is the next best thing. And then just making sure that we're still wearing masks. One thing that's common in all of this guidance is face coverings. It can be something as simple as a t-shirt mask, or if you want to wear something more stringent, that's fine. But the orders just require all employers to require of their employees to wear some sort of face covering while they're working. That includes our manufacturing sector, our bowling alleys that are just coming back online, fitness centers. If you're there working, you have to have a face mask, face covering. Our current orders are in place until July 1st. As we have progressed through since the beginning of March, we saw the orders roll out step by step, and as we're coming out into opening businesses back up, those are happening the same way. So while you think that sports are all open and fitness is all ready to go, again, that is being broken out in very small sectors and groups of like activities. So it's important to stay current on the website and making sure that you understand what's being allowed at any given point in time. As we work through the guidance, we see that orders and guidance changes on an almost daily basis. So we are doing our best to stay up to date. So if you call and ask us a question, we're going to give you what the answer is for that date and time. Just be mindful as we progress through this pandemic and figuring this out for ourselves, that guidance is likely to change. So it's important that you have access to these web pages, or even calling our health department, or if you're not within Montgomery County, your own health department. The Ohio Department of Health also has a helpline that they can be reached to answer questions as well. So one of the questions I believe that was asked ahead of time is, how often should you be cleaning and sanitizing surfaces? It's going to depend on what that surface looks like. If it's something that's high touch, you're probably want to be doing it more frequently than something that's not. So high touch areas such as doors, point of sale units where you swipe your credit card, light switches, doorknobs, counter spaces, anything that your customers would come on contact on a more frequent basis, you would be encouraged to clean those, probably at a minimum of every 2 hours. Hand sanitizer should be made available for your customers and your employees as well. And if those are in short supply, is making sure that your bathrooms are adequately stocked with soap and paper towels. Soap and paper towels or an air dryer are the most important part to keep us healthy. So frequent hand washing is important. Within your business, if you have a business, areas to look at would include where your staff sits. Do they sit in cubicles? You want to make sure that they're 6 foot apart from each other. And if you can't do that, barriers should be installed. If you have a counter where you directly interact with their customers, there should be a barrier between you and them if you can't maintain that 6 foot either. Just like we see in the grocery stores, those plexiglass type barriers would be something that's acceptable. I'd like to stress, one of the most important things is communication. We've been tasked, in the beginning we were tasked with what's essential and non-essential, and we worked with many businesses that we've never worked with before, and helping them determine and maneuver through these guidelines and mandates that are required of them. We've probably handled over 2,000 complaints on about 1,000 businesses since this has started. This is in addition to our everyday workload. We've assigned it to our unit that handles inspections in the field. So our food staff and our well and septic staff have been reassigned to help out with these complaints and address them on the phone or visiting in person. And one of the most common themes that we're seeing is communication. Either HR or management didn't communicate with the employees what it was needed or what was expected of them. So being clear and offering concise direction to your staff is imperative to keep us from coming out to and address a complaint, but also to keep your staff happy and making sure that they're knowledgeable of what they need to do. So again, hand washing, face coverings, and 6-foot distance is important. Some of the areas that we've worked through most recently include sports and sports leagues, as well as non-contact sports and outdoor activities. Non-contact sports have been permitted to start up, and that includes things like tennis, softball, baseball, golf. Those all are allowed to begin operating and having practice. Contact sports such as football and soccer and volleyball have not been permitted yet. However, they can still get together and do conditioning, because the Ohio Department of Health recognized that conditioning is an important part of staying healthy. So those teams can get together and do conditioning type activities. They just can't scrimmage, and they can't play against each other or have any games as such. This week, our daycares and day camps came online. So we're starting to see more daycares open up for businesses to have, so their staff has access to daycares and a place for the children to go. Banquet centers have also come online as of June 1st. Banquet centers for wedding receptions or gatherings are permitted. They need to have 300 or less people at those gatherings, and they have to be seated. There's to be no entertainment type activities going on, so no dancing. No tables larger than 10. They are being required to follow the same guidance that is required of a restaurant and bars. So we'll start to see more wedding receptions occur also. See what else. I'm skim through my questions here.
Hey, Jennifer.
Yes.
This is Dan. Can you unshare your screen there?
Yes.
I was going to share some stuff while you were talking.
Oh, I'm sorry.
Because it's just stuck on the, I'm not sure if everyone knows you can do split mode so you can see the presentation screen and the people at the same time by going to the top there, but okay. And on your dancing, Jennifer, finally I have a reason not to dance. So it's not all bad news.
Yeah. One of the questions also, along with entertainment, is, are bands permitted? So bands are now permitted in entertainment type circumstances, like in a bar. A band can play for the customers. Again, no dancing. The band needs to be 6 foot apart. The guidance is specific. There's to be no mariachi bands, so the bands cannot walk around and play from table to table, but they can stand on a stage and play and sing. Some of the other questions are...
I have a story on the bands, Jennifer.
Yes.
Talking about how quickly the information changes. And for those of us who are in communications, you can appreciate how frustrating it is, because our job is to provide accurate information to the public, but it's challenging sometimes to get that information. So speaking about the bands, we were on a call. They have daily calls and weekly calls on various different topics. So they were discussing some of the new guidelines that were going to come out. And during the call, they were explaining there's no bands allowed, and they're going on about the bands. And then in the middle of the call, they said, "Oh, now bands are allowed." So during the call, when they were telling us there was no bands, they said bands are allowed. But still no karaoke and no trivia at this point. Sorry to interrupt there, Jennifer.
That's okay. So on our website, we have links to various items of interest for you. There's videos that you can share with your employees and general guidance. There's also links to the Ohio Department of Health coronavirus page, where you can see all those orders directly from there. So if you can find our webpage, you can get to the sector-specific guidance.
I think I just shared that for you.
Yeah.
So yeah, in what Jennifer's describing, if you click on this link here, we do have a little video there, but if you click on this link, it'll take you to our page where we have information. This center section here is links out to the Ohio Department of Health's page. We were, when it began, posting the information on our site, but it was changing too rapidly to be able to keep up with it, so we are linking out to those things. But we do have some highlighted items here. So the data section, you can go in and it links to, this is the Ohio Department of Health dashboard. And if you look here, you click on Montgomery County and there's 684 cases, 173 hospitalizations, 16 deaths. This is updated every day at 2 o'clock. And then you can go through and look at other metrics on there as well. There's also, under the data section, just some more call outs from Ohio Department of Health. Then we have our specific Montgomery County information here. So if you click on here, you'll get some specific maps and things. So this map here illustrates the cases in the county by zip code. So you can see, for example, let's see, I don't even know, 45345 has between 1 and 11 cases by the shading here, and that's as of yesterday. So it kind of gives you an idea of what's going on around the county. This is shows you where the cases are, you know, roughly. This is the same kind of thing, a heat map of the cases. And we also have videos here. Various videos here you can share on a whole bunch of different topics. We also then have some flyers and handouts. I've been distributing some of these to our municipal PIO partners, but you're also welcome to grab any of these off you want here. I want to thank Kate out at Centerville. I played golf over at Yankee Trace. I saw my flyer hanging up when I went in, so that was that was nice. But so anyway, just a whole bunch of information here for you, and then also the latest information goes along here. Also, we also encourage you to follow our Facebook page. It's Public Health DMC, where we provide a lot of information there as well that you can share out. Same thing on Twitter.
Dan, this is Jackie. I wanted to just cut in for a minute. If I could again ask everybody, maybe there were some of you that joined after the meeting had started. If you can mute, please. There is some background noise and that will help keep that away. Thanks.
Okay. I think that's all I had on that, Jennifer.
Okay.
You were in your presentation.
So as an employer or as an event planner, if you are notified that you have an employee that is ill or been diagnosed with COVID, it's important that you get in contact with the local health department that your business is in, and we will help guide you through what that process looks like. I'm sure you've heard in the news about contact tracing. So contact tracing, we start with the person that's been diagnosed, and we talk to them about where they've been for the last, for a certain time period, depending on their diagnosis. And then we would go back to those areas and have conversations and identify those people or businesses and work with those businesses to come up with a monitoring plan within their facility. The last thing we want is an outbreak in a facility. So it's important that we can stop that illness spread as quickly as possible. So our nurses are available to help answer questions about what that might look like and what you would need to do in your facility. If you have positive cases within your facility, we also make available my staff to come out and do a walkthrough, and we will look at the business specific guidance for your business, depending on what kind of business you are, and make sure that you're lining up with everything that is being required and give you a little bit more direction on what you should be doing if we see some deficiencies there. at that point, it's not punitive. It's just as a attempt to help you get on the right track so you stay ahead of this and you don't lose your workforce. So we do offer that as a consulting type. Those facilities that we've been out to, we encourage them to take a heavy stance on cleaning, and again, back to the communication. Sure, their staff and employees knows what's going on and what's expected. So as far as outdoor events, there was a question in the chat. Is there any guidance regarding large gathering at outdoor events? So outdoor events are still prohibited outside of 10 people for an event. So right now, parades are prohibited, festivals, things of that sort until July 1st, or until they decide to modify.
Jennifer, if I can jump in on that.
Yes.
That's a source of, I know, frustration for planners and event planners in that these orders only go till July 1st. So we'll get questions about, what about my event in August or September or whatever? All we have right now is what the guidance is. We're not anticipating all of a sudden large events to be allowed. Anything in an arena, a stadium, a concert venue, those are the last types of things that would be open, because it's harder to maintain social distancing in that. You'll even notice, or you may have noticed, that in the order about restaurants, in that order for restaurants and bars, it's required that people must remain seated when they're eating and drinking. So you can't have a bar or restaurant situation milling around or interacting in any way. They have to be seated. So, you know, in a concert venue, a stadium, that type of thing becomes more problematic because people gather. In many ways, that's the whole point of having those things, is for people to gather. And the whole point of the health orders is to have people not gather. So it's kind of, they contradict themselves there. But unfortunately, that's the only way to stop the spread at this point, is to keep people away from each other as much as possible and to practice all those social distancing guidelines, hygiene guidelines. And any, you know, people may say, well, you know, the mask isn't going to make a difference, the cleaning's not going to make a difference. Not one individual thing is going to make a difference. It's all the things layered on top of each other that together help reduce the risk. You're never going to reduce the risk completely, but it's about eliminating the risk as much as possible to protect as many people as possible. We've been so far on the good end of it here in Montgomery County, in that our case level has been relatively low compared to other urban areas throughout Ohio. Montgomery County doesn't have the same population density as a Cleveland or a Cincinnati or a Columbus. So that helps in that regards and keeping people away from each other. Also, we believe a lot of people have, you know, maintained that social distancing. We know the masks are an issue that, you know, are hard for people to get a grip on, but as best as we can, we're trying to manage that. We do have a call center. It's at 225-6217, where we have a staff of people on those phones to answer calls. Last time I checked, we have had over 6,000 calls since this began to that call center. And it's a range of getting information about COVID, getting information about services, complaints about businesses, complaints about people, all those things wrapped in together. We do have a complaint process that Jennifer's team works through. And I don't know, Jennifer, if you wanted to get into all that, but I just wanted to touch on the staffing. We have normally, Jennifer's environmental health department does regulate restaurants and bars and food service entities like grocery stores, snack bars, those type of things. We normally do not regulate private businesses or any businesses that aren't providing food service in a sense where we have a program set up to regularly inspect them. So we put together a team of people who are now shifting from one public health area to another to help with some of the situations at the businesses. And early on, it was a little bit of an issue with the complaints, and it still is an issue in terms of trying to manage all the complaints and work through them and follow up on them. We are following up on all of them as best we can. You know, we may get a complaint that says, hey, I was at Subway and someone wasn't wearing a mask. Well, something like that doesn't really help us any because it doesn't identify the Subway. We have no indication of where that is. But some complaints are a little more specific, so we can look into that. The restaurants and bars and food service are a little easier to deal with because we have preset contact information for those businesses. We have a staff person who regularly inspects them and is assigned to that specific location. So if we say a location, we know exactly which person handles that location, and that person can follow up with that group. When it came to businesses and, you know, especially on essential, non-essential, so forth, you know, we didn't even know that business ABC existed. We didn't know who to contact or how to contact them. So that took time to just work through in terms of figuring out who even the proper contact is. So we do have teams on both those ends trying to work through the complaints. Anytime there's a new order or a change in the order, there's questions about it. Everything cannot possibly be covered in the order. So it's more, the spirit of the order is to keep people away from each other. So when you look at the orders that way, I think, although it's frustrating, certainly for people in your industry, and it's frustrating for us as citizens, that's really what it's about in terms of not doing things to bring people together. So just because you're allowed to do things, public health is still recommending you don't necessarily do them. So, you know, you're allowed to go to the store 10 times in a day if you want to. We recommend you combine your trips and only go and get what's necessary and only bring one person from your family to the store, things like that. So we're getting into an area of, you know, what's technically allowed and then what is in the best interest of your health, your family's health, and the public health in general. And, you know, one of the primary tenets of public health is to stop the spread of disease. That is what it's the core of this is. And Jennifer talked about contact tracing. Contact tracing is something that is part of our regular program. We have a team of contact tracers. We do that for other type of outbreaks. We do it for sexually transmitted diseases. We do it for HIV. We do it for the mumps, the measles, you know, things like that. So we will do contact tracing, and we have a team that does that. Now we are expanding that. We've added a whole section of people to be able to do that because there's so many more things that need to be traced. So let's see, I have a question here. Do you have any guidance? Do you have any guidance on family style service for events versus buffet? Oh, I think I know this one, Jennifer, but I'm going to let Jennifer. There are no buffets allowed. So the concept is whether it's in a restaurant or outside of a restaurant, we do not want people self-serving themselves, because when you touch that handle of the potatoes, you got 200 people touching that, and that's a problem. So restaurants need to serve that food individually by an employee so that one employee is the only person touching it. And again, it's about reducing the risk. Say you have one plate of potatoes and there's one spoon there, 200 people come by and scoop that up. That's 200 times you're possibly spreading COVID. Whereas if it's just one employee, it's still a risk because someone's still touching it, but it's only one time a risk versus 200 times. And I think that's at the core of it. Did I handle that okay, Jennifer? Did I cover everything?
Yes. Yes. So the order is specific to buffet. So an employee can serve you like Dan described. I would highly discourage against family style. You have a group of people that are sitting at a table. You don't know if they're coming from one household or if they're coming from multiple households. So I would strongly discourage family style and offer plated meals or a buffet that's served by staff of the event.
And, you know, it goes back to how COVID spreads. The number one way it spreads is through aerosol droplets in the air. So me coughing, sneezing, breathing on you, that's how it is spread. Secondarily, it's spread through touch. So those droplets get on the surface. They last for a relative period of time, depending on the type of surface. Then you touch it, and then you touch your face or your mouth, and you contract COVID. Certainly eating is a situation where you will be touching your mouth most likely a lot. So it's going to be a higher risk situation there.
Yeah. Self-service beverages are permitted in gas stations and convenience stores as well as in restaurants now. We saw this change frequently last week. So as we stand right now, self-service beverages are permitted. We encourage those places that have it. If you're a hotel, motel, and you have self-serve beverages, you can open those back up, but make sure that you're quickly and frequently sanitizing those touch points as well. So guidelines for 5Ks and running events. We highly encourage that you pursue a virtual event at this time for those type of events. That's been our recommendation from the beginning.
And that would still fall under the no gathering over
Get mass
10,
gatherings.
you know, because you're looking at the start and the finish where everyone's together. And unless you have a very small 5K, you know, they're going to be together. And that's a mass gathering. They did lift last week gatherings in the home, so you can't have more than 10 in your home. But for public events outside of the home, other than a banquet facility or a restaurant, it's still 10. And even having said that, even with, you know, more than 10 people in a restaurant, they still need to be separated. So you can't have more than 10 people at a table. So if you've been to a restaurant, you'll notice they're separating out. And I don't know if we have any restaurant people specifically on here, but the couple restaurants I've been into have been doing a good job of it. They're getting innovative. And I think a lot of people now will be judging restaurants and all facilities really on safety. So before I might choose a restaurant just based on how good that hamburger is or how good the service is. Now I'm throwing in how safe is it for me to go to that place? Is it too crowded? Do I think they're taking the proper precautions? So that is going to be something that I know people are considering. You know, some people aren't going to consider it at all, but many, many people do. So if you're a business, I think, you know, it's definitely you want to do. And I notice businesses are innovating. So we have what's mandated, and then we have what's recommended, but then we have businesses just coming up with their own things that aren't even listed. That's like, hey, you know, we think this is a good idea to do. We're just going to do it and, you know, make it better for everybody. And remember, for the businesses, it's about protecting yourself, your employees, their families, and then also your customers. We know it's frustrating for businesses not to be able to open, not have full customers, but if everyone gets sick at their location, you know, you're not going to have any customers or any employees. So we have heard stories where some businesses were allowed to open, particularly some restaurants, but they didn't feel it was safe to open. The employees didn't feel safe coming in, so they were not opening. So that goes back to my other statement, you know, just because you're allowed to do it doesn't mean you necessarily have to do it. And everyone has to make their own judgment on that. You know, one thing we're encouraging here at Public Health, we're working on something that's called Health in All Policies. And it's the way that decisions you make as an organization or a business, how it impacts the health of yourself, your employees, and the overall community. So one thing that, you know, goes to the heart of this is sick leave policies. Many organizations, particularly in the hospitality industry, do not provide paid sick leave for their employees. And that's a problem. One of the tenets of this COVID, how we're trying to stop the spread of COVID is for people to stay home when they're sick, to not spread COVID, not spread anything else. Well, if someone does not get paid sick time, that encourages them not to come in to work when they're sick. So, you know, it's something that can't be changed overnight. I realize that, but it is an issue when employees feel compelled to come in and work when they're sick. So anything that can be done, particularly during this time of COVID, to alleviate that would be, you know, appreciated by public health and be appreciated, I'm sure, by the other employees and the customers. So that's just something to keep in mind in terms of the decisions that we make as businesses, impact people's health. Let's see, we have more questions, Jennifer, there?
Yeah, we have a couple of questions. So the question about our rental venues, the Fairgrounds and Event Center, the spirit of the order would say that those events aren't permitted because it would be considered a mass gathering. I do know the Ohio Department of Health is working through what some of those events could look like and what the guidance for those would be. So as of right now, those wouldn't be permitted. And then the same thing with a fundraiser. The order is specific to 300 for a wedding reception. It does not talk about fundraising, so I would say no to that.
On the guests in your building for an outdoor event, restrooms, again, nothing can be more than 10. No events or no things can be more than 10 right now, unless you're at a restaurant or a banquet facility. So, but yes, people could use restrooms wherever in a store, whatnot, but you're still limited to 10 at this point. And again, this is, as we speak today, it does change quickly. We know that the different sectors are working on various ways to come back into being open. For example, the casino group has been working on trying to put together a plan to come back, to keep it safe for their employees, keep it safe for their customers. There may be news coming soon in terms of a date announcement. We don't have that date yet, but I know they're working to come up with something. So the governor has changed his press conferences from every day to now Tuesdays and Thursdays, unless there's some overriding factors. So we're anticipating him today to provide some information. We don't have details on that yet. We usually only get word about that very short notice in terms of what's going to be said. And many times, if you're following the news conference, he's announcing things where all the details have not been fully worked out yet. So that's also frustrating for us in communications when he's announcing a new order or a new modification of the order, relaxing of the order, what have you, but all the details of that have not been fleshed out yet. So immediately we're getting calls as soon as that's announced, but we don't have the details. And remember, the point of this is these are not Public Health Dayton Montgomery County's orders. These are from the Ohio Department of Health, which we are obligated to enforce. So we're looking to them for guidance in terms of what is what needs to be looked at. We have more questions there, Jennifer? I think I saw a couple pop through here. Museums, travel and tourism, yeah. Jennifer, do you have anything specifically on museums?
Museums, I believe, are still, I'm looking right now.
Yeah, I think it's part of the travel and tourism.
Yes.
So it's not been finalized yet. If you go to the Ohio Department of Health website there under advisory groups, you can see who's on those groups. So for travel and tourism, we have various people from Columbus Convention Center, Coach USA, Cincinnati Zoo, Hocking Hills, Cedar Fair, AAA, things like that. But we don't have anything specifically for museums yet. But yes, when they do open, there will be guidelines around social distancing. So in terms of preparing, you can pretty much take the recommendations that are already out there. There's the basic ones about social distancing, wearing masks, signage, doing everything you can to eliminate people coming in contact with each other. Jennifer and I were just in a meeting at 9 o'clock today. We were walking through the building, as many of our employees are working remotely right now from home. Some of our public services have been either reduced hours or have gone all virtual, but we're looking at ways to modify the building and service areas to reduce the spread. So where people would come up to a counter or a window. We're putting in plexiglass barriers, things like that, that would, help stop the spread.
Yeah.
Right now with businesses, one thing real quick is that even those businesses that are open, they need to set a new, I want to say attendance figure, but a new maximum occupancy. So if you were before allowed to have 500 people in your store, you need to evaluate based upon the social distancing guidelines, how many people you think you could comfortably get in there below that number and still keep your distance. And then you're going to have to post that number. So that's something you can be thinking about. There's some things I can just think of off the top of my head with museums is, one, people are moving through usually in smaller groups, that's good. But if you're having any presentations where people would group together, then that would be an issue. So, any type of grouping is going to be a problem, but we don't have the specifics yet. Jennifer, did you have anything on that?
No, that would, yeah. So we can garner a lot from the other guidance so far that's been released. But as far as entertainment, so amusement rides, carnivals, amusement parks, water parks, aquariums, zoos, museums, arcades, fairs, children's play centers, playgrounds, funplexes, theme parks, concert music halls, those are all still ordered closed until July 1st, or until the governor of the Ohio Department of Health releases those. So those are all areas where people come together, and we just haven't seen that guidance yet from the state.
I see something about where they don't have control of the space with regards to airflow. Asking for top two things, the top two things in all of this are social distancing, stay as far apart from people as possible. And then on top of that, you can wear a mask, you're required to wear a mask at work. However, there are exemptions of that. So if you're alone in your own office, for example, you don't need to wear a mask. So right now I'm in my office, Jennifer's in her office. We have the door closed. We don't need to wear masks in here. But when we were walking around previously, surveying the building for new signage and adjustments, everyone in that group had a mask on as we were walking through the building and interacting with each other. We are a little bit fortunate in a sense here in that we're in the Rybold building. That is an older office building. So it was the trend, in the past decade or so has been the open workspace, the not even cubicles, but just people right up next to each other with the desk. We never really did that because this building was separated up into offices. So many people have offices already. So that helps in that regards. But where people are near each other in a cubicle space, we're adding plexiglass dividers. So even though you don't control the building necessarily, and that's the case with public health at the Rybold building is owned by Montgomery County. We pay rent to be in the building here. So we have a landlord, just like you have a landlord, and the common spaces and so forth are their responsibility. But within our spaces, at the desk where they're maybe close together, we're putting up plastic barriers between each other. And then we're trying to space people out if there is room to move them apart a little bit or to alternate desks. We're still working remotely. We have, I don't know the last count, but probably at least over 100 people working from home or working staggered shifts, coming in every other day, that type of thing. So, there are some things you can do. And on the space, we did get a lot of complaints. We do get a lot of complaints about cleanliness. And I will say that in terms of what needs to be cleaned and not needs to be cleaned, we're encouraging everybody as part of the cleaning process. So if I'm an employee and I think that the door handle into my office area is not cleaned enough, I need to get up, go over there and clean the door handle. That's part of my responsibility. Now, we do have cleaning supplies out there and available for staff to be able to do that, but you certainly can't expect building maintenance to, every time someone goes through a door, to be able to clean that door handle. So you need to be able to do that as well on your own within your space. And I don't think anybody's landlord's going to have a problem with anybody over cleaning. So I'm sure they would appreciate that. But we did, here at the Ribble building, they have increased the cleaning by the contracted maintenance that they have. And, you know, we have our own facilities person that also does some cleaning. And they do, one thing we do here also is there's a spray that they do once a week. And I don't have the exact details of what that is, but it's sprayed on the surfaces, and then it reduces the amount of time that a virus could stay on that surface. So they do that once a week to try to cut down on spread on surfaces. So that may be something you can do in your workspace or your office, even though you don't own the building, but you may be able to incorporate something like that.
Sure. So we have a question about how many people can be in a gym or an ice rink. There is no set capacity other than what the business set the capacity to be. So you have to still maintain that 6-foot distance. So whatever you have to do to maintain 6 feet between people working out or in the ice rink, that's what your capacity is going to be. So that's up to the business owner to set. If we were to get a complaint and we would come in and we would see that social distancing isn't being adhered to, that's what we would address. But you do have to establish capacity, and it's all based around that 6-foot rule. Are large meetings such as 1,000 covered under tour and travel guidelines? So as of right now, the governor's order is you can't have more than 10 people. So if that meeting were to happen between now and the July 1st, that wouldn't be permitted. I think you just have to pay attention to see what the announcements are and what the guidelines will be released from the state level, and also listening to what the CDC guidelines are for those larger meeting types. I know our professional conferences and meetings that we travel to or attend to have either been canceled or they've moved to a virtual format as well.
And yeah, that's one of the most frustrating things in terms of trying to plan and organize when you don't know what the conditions are going to be in September, October, or even July for that matter, because the current condition is only till July 1. Now, we're hoping that even though businesses open up and people are going back to work and more things are happening, that the cases do not rise significantly. If the cases rise significantly and the hospitals are overwhelmed with people in the emergency room and the ICU, so forth, you know, that is going to really be a game changer in terms of what happens here in the state of Ohio. You've probably seen coverage in other parts of the United States and other parts of the world where the cases and the deaths and the number of people in the hospital are really out of control. And we hope that that doesn't happen. And that was the reason for the guidance that was put out there. And, you know, from a messaging standpoint, it's also very difficult for us at public health because the numbers are down relative to other parts of Ohio and other parts of the United States, New York City, for example. There's a tendency to people think, well, there's no problem. We don't have to worry about this stuff. But one of the main reasons the numbers are down is because of all of these things that have been done to reduce the numbers. So it's kind of a catch-22. You want to be open, you want to have people doing things, but then you risk a greater spread of COVID, and then the people, you know, having to have further restrictions. And I will note, you know, the COVID cases are, even the people who aren't in the hospital necessarily, it's a longer, more frustrating / painful situation. So it's not like the flu in a sense, like, oh, I'm going to have the flu for 2 or 3 days and then I'm out of there. In some cases it may be, but in a lot of cases, people are sick for months before they actually feel better and well enough to be able to go to work. You're talking about a fever over 101 for weeks at a time. You know, I mean, that's an issue. And certainly the people who have pre-existing health conditions are at greater risk. Any other questions there? I think that's. Jennifer, do you have anything else on our behalf?
I guess maybe the main takeaways are paying attention to the Ohio Department of Health's webpage and announcements. Using us as a resource, we're more than willing to help you out and get you on the right start. If you're not open yet and you're looking to open, give us a call. There's lots of guidance documents out there, and we'll get you pointed in the direction that is most applies most to your type of business and operation.
Well, Jennifer and Dan, I want to thank you both so much for doing this for us today. This is really valuable information. I think I know I've learned some things today, and we do try to kind of keep up with what's going on, but certainly the questions and the answers that you gave are going to be really beneficial to all of us. So once again, to everyone, a recording of the webinar will be available later this week on the CVB's website, which is DaytonCVB.com, and it's if you go to our YouTube channel. If you have specific questions for Dan or Jennifer, you can also contact them, I'm sure. So, their contact information, I believe, have we shared that someplace, or can you share it with us now? Your email?
Yeah, it's the email is dsuffoletto, SUFFOLETTO @PHDMC.org. Jennifer's is J Wenzel, WENTZEL @PHDMC.org. But to make it really simple, we have a info @PHDMC.org. That goes into our group mailbox, and then someone will route that to the proper channels. If you want to call me directly, my number is 224-3892, or you can just call our regular phone number is 225-5700, and that'll also get routed to either Jennifer or myself.
Thank you. And we want to thank everybody who attended today. You know, it's so important for all of us to come together as a community as we're all helping to drive a recovery. We are going to continue also on our website to share our COVID-19 resources pages. So please check there periodically too. We do try and keep that current with information from the Department of Public Health, as well as the Ohio Hotel Lodging Association and many other resources. And I want to invite all of you to our next webinar, which will be Wednesday, May the 17th at 3 p.m. We will address our organization, the Dayton Convention Visitors Bureau's revised marketing plans and initiatives, and we are eager to discuss with each of you your ideas and your input for what specific needs you have and how we can best collectively address those needs to promote Dayton and Montgomery County and bring recovery to our local tourism economy. So please keep an eye out for that upcoming information. Once again, thank you, Jennifer. Thank you, Dan, so very much, and to all of your team at Public Health for all the great work that they're doing. Thank you so much.